Human Sexuality class, Infomercial. I will be presenting on the topic of vaginal cancer, which is a very rare form of cancer in women. Alright, so what is vaginal cancer? Vaginal cancer is any form of cancer that forms in the tissues of the vagina. It is an uncommon cancer of the female reproductive system. Vaginal cancer begins when normal cells in the vagina change and grow uncontrollably, forming a mass called a tumor. There are 4 different types of vaginal cancer. The first being known as squamous cell carcinoma, which develops in cells lining the vagina, usually close to the cervix. This makes up for 80 to 90% of cases of vaginal cancer overall, and it develops slowly through a precancerous condition called vaginal intraepithelial neoplasia. The second form is known as adenocarcinoma, which begins in the vaginal gland tissue and makes up 5 to 10% of cases of vaginal cancers. Third, clear cell adenocarcinoma, and this is a unique form of vaginal cancer. It occurs in women whose mothers took the drug diethylstilbestrol, or abbreviated DES, during their pregnancy between the late 1940s and 1971. Lastly, melanoma. This form of vaginal cancer begins on the skin of the vagina or in other internal organs. Melanoma is usually found on the skin exposed to the sun and often appears as a dark-colored tumor on the lower or outer parts of the vagina. Like many other forms of cancers, there are risk factors involved in developing vaginal cancer. A risk factor is anything that increases a person's chance of developing cancer. The first is age. For women between 50 and 70 years old, there is a higher likelihood of developing vaginal cancer. 50% of women today with vaginal cancer are older than 60. Second, human papillomavirus, or HPV. Research indicates that infection with this virus is a high risk factor for developing vaginal cancer. Smoking. It's generally hard on your body, and smoking may increase the risk of contracting vaginal cancer as well as many other cancers. Diethylstilbestrol, or DES. Women whose mothers took this drug during their pregnancy between the late 1940s and 1971 have an increased risk of clear cell endocarcinoma. Here's a picture of the molecule of this drug. Some additional risk factors of obtaining vaginal cancer include having had cervical cancer, having had previous radiation therapy, as well as having previously had a hysterectomy, which is a procedure that removes part of or all of the uterus, as well as women who have had or who have used pessaries. A pessary is a medical device used to keep a sagging uterus in place, or as a method of delivering medication. Long-term vaginal irritation from using a pessary can increase a woman's risk of vaginal cancer. Alright, so here's a random brainstorm question. So out of 5,500 women in the United States, how many will be diagnosed with vaginal cancer during her lifetime? Take a moment to pause the video here and think about your answer. So the correct answer is actually 5. So vaginal cancer is uncommon, and out of 5,500 women, only 5 will get vaginal cancer during her lifetime. Methods to prevent vaginal cancer. Of course, you want to go to your annual gynecological exam. During this exam, the doctor will take a family medical history and perform a general physical examination of the pelvis, and also feel a woman's uterus, vagina, cervix, and other reproductive organs to check for unusual changes. Here's a picture of a pap smear during these exams. Alright, so also you want to delay intercourse until your late teens or older. Avoid sexual intercourse with multiple partners. Avoid sexual intercourse with someone who has had many partners. Practice safe sex. Have your regular pap tests. And not start smoking, as well as having had the Gardasil vaccine, which is used to prevent cervical cancer for women and girls between ages of 9 and 26. It is also approved to prevent vaginal cancer. Alright, so the symptoms of vaginal cancer are abnormal vaginal bleeding, abnormal vaginal discharge, difficulty or pain when urinating, pain during sexual intercourse, pain in the pelvic area, pain in the back or legs, and swelling in the legs. And the pelvic area really refers to the lower part of the abdomen between your hip bones. The most common treatment of vaginal cancer is surgery. It is the primary form of treatment, and surgery is the removal of the tumor and surrounding tissue during an operation. Surgical options include laser surgery, which is use of a beam of light which burns off the cancer of the skin. This is used to remove precancerous cells or a tumor. There's also excision, which is the surgical removal of a tumor and some surrounding healthy tissue. A vaginectomy is the complete removal of the vagina. And radical hysterectomy is when the cancer is spread to other parts of the reproductive system, and either the ovaries, uterus, fallopian tubes, or lymph nodes need to be removed. The second form of treatment for vaginal cancer is known as radiation therapy, which utilizes the high-energy X-rays or other particles to destroy cancer cells. This may be used alone or after surgery. There are different types of radiation therapy, such as external beam radiation therapy, which is radiation given from a machine outside the body, as seen in the lower right-hand corner picture, as well as internal radiation therapy or brachytherapy. This involves tiny tubes of a radioactive substance which are placed in the vagina for 1 to 2 days. Lastly, there's interstitial radiation therapy, which involves radioactive material that is injected directly into the tumor site. Alright, so the third type of treatment for vaginal cancer is chemotherapy, which is the use of drugs to destroy cancer cells, usually by stopping the cancer cell's ability to grow and divide. This regimen of drugs consists of a specific number of cycles given over a set period of time for their patients. The goal of chemotherapy is to destroy cancer remaining after surgery, or slow tumor growth, as well as reduce side effects. These drugs are given intravenously or through an IV. Some are also given intravaginally to treat early-stage vaginal cancer. Alright, so time for another random brainstorm question. So if vaginal cancer is found at the earliest stage of development before it has spread, what is its 5-year survival rate? So I'll give you a second to pause the video here and think about your answer. So the correct answer is actually 84%. Alright, so the incidence of vaginal cancer cases among different ethnic and cultural groups within the United States. As stated before, vaginal cancers are rare, therefore official statistics for this type of cancer are not exact. However, squamous cell carcinoma, which is the most popular form of this cancer, has nearly 730 new cases each year in the United States. More Black and Hispanic women get vaginal cancer than women of other races and ethnicities, which is quite similar to the cervical cancer rates. Alright, so thanks for watching my infomercial. I hope you learned a lot of valuable facts about vaginal cancer. For more information, please feel free to visit these two websites. They have awesome information. And also, just thanks for watching.